It's great to be joined today by Sam Sachs, writer, reporter, and co-founder of the Watchdog News website, the District Sentinel. Sam, last week we talked about this DEA decision, much anticipated in many ways, where they ultimately opined that marijuana should be kept as a Schedule 1 drug, along with heroin, other opiates, etc. We talked about the long list of reasons why this does not seem to be a good idea if you are a progressive who supports both consistency with regard to drug policy, progressive values, and sort of recognize the failings of the war on drugs. Give me your sort of top line concern with this. Is it along the medical research side? Is it along the war on drugs criminal justice side? Where should we be most concerned about this decision?
Well, both sides of that is concerning. I'd say what's also most concerning is the fact that the Drug Enforcement Agency and the Department of Health and Human Services seems to be not existing in the same reality that the rest of us are. The DEA's decision on this matter to keep marijuana as a Schedule 1 drug alongside heroin and LSD and other drugs that you would think are potentially far more damaging than marijuana is based off a recent study by the Health and Human Services, which the DEA petitioned them to do to do another study on marijuana and its possible medicinal value. And basically, HHS comes out and says that marijuana still has a high risk of abuse. It has no known medicinal value, and that even testing marijuana, even in controlled environments, could prove to be dangerous. Therefore, we need to keep this as a Schedule 1 drug. Now, that just doesn't jive with what is happening all around the country right now, where there's over 1 million patients, 1 million people in this country who are on medicinal marijuana. There are 25 states that have legalized marijuana for medicinal use. Another 4 states in the District of Columbia have legalized it for recreational use. So there are tons of people who are using marijuana right now as a medicine to treat a whole number of issues, from cancer to pain to epilepsy. You hear these stories all the time, and it's shocking that the DEA and the Department of Health and Human Services, for some reason, isn't understanding this.
There's this insane vicious circle that exists where most of those politicians that are against loosening the restrictions around this type of research and around legalization and decriminalization, as well as the DEA and the FDA, et cetera, they all say we're totally open to having our minds changed about cannabis, about marijuana. We just want scientifically valid and well-controlled clinical trials done under the investigational new drug application paradigm. The problem is that that's a paradigm that makes it very difficult to really do a lot of research, which in turn will make it so that we never actually get the loosening of restrictions. It's a circle that is completely closed, and to me makes absolutely no sense for anybody who says, I'm completely open to having my mind changed on this. Here's the mechanism through which my mind will be changed, and it's an incredibly restrictive mechanism.
Right. I think only the University of Mississippi right now has permission from the U.S. government to do this sort of research on marijuana. And this whole approach that you just broke down, it makes it seem like this isn't settled science. Like there's still a doubt whether or not marijuana can be an effective drug to treat a number of ailments in this country, when it is settled science in 25 states and for more than 1 million people are using it. And just there was research done on Medicare Part D recipients, and they found that because a number of Medicare Part, this is a prescription drug program, a number of people on the program are switching from traditional painkillers and using medicinal marijuana, which has in turn saved the government something like $230 million recently. So the effects of this, not just the people who are using it, prove that this has medicinal value, but it's also saving the government money in the long run as more people use marijuana to treat their ailments rather than the pharmaceutical companies' offerings. And if you look at who's behind it, I think this was an investigation done by Lee Fong over at The Intercept a year or two ago. A lot of the forces that are lobbying against marijuana legalization at the state level, it comes on a lot of ballot initiatives, are pharmaceutical companies. So they have an interest at stake here, and that's what could be one reason why you don't see the federal government and policymakers moving as quickly as the rest of the country seems to be moving on this issue.
And that sort of connects to another area where there's a huge double standard, which is that I can't think of a sort of logically consistent case for cigarettes and alcohol to be legal and regulated and taxed, but not marijuana, period. I mean, I feel like I can say much more about that, but I don't know that I need to. I have not heard a compelling case for why cigarettes and alcohol should be handled the way they are, and for marijuana to be a Schedule I controlled substance.
I haven't heard one either, other than a more cynical argument of the influence of these industries, but of the tobacco and alcohol industries. But even just look at what you hear on the campaign trail, or were hearing. I suppose you're not hearing much about it anymore. But the opioid abuse epidemic that's hitting the country. This is a serious problem all around the country. You heard politicians talking about it, and not a single person has ever died from using marijuana, and yet we're hooking people on all these painkillers that are proving to be very deadly for people, ruining people's lives, when there are medical alternatives to a lot of these drugs in marijuana, if the government and policymakers would get on board with this. I mean, as I mentioned, half the country already is, or half the states in this country already are on board with it, and over 1 million people already are on board with it as well. But there are serious problems with a lot of drugs that we allow that aren't considered Schedule I drugs, but are far more destructive than marijuana.
Not to mention, a lot of those Schedule II painkillers are one of the actual leading gateways when prescribed by doctors that will get people hooked on the Schedule I drug of heroin, because it ends up being much cheaper to buy heroin on the street than to try to convince your doctor to keep giving you Schedule II drug prescriptions or buying those pills on the street. That actually is a gateway mechanism that's established, and that also seems to be sort of missing from the context of the marijuana discussion. And here in Massachusetts, that's incredibly visible, as I know you know. Speaking of Massachusetts, there is going to be a vote here, a ballot question in November again on marijuana. Do you believe that those ballot initiatives and what we've seen happen in some states are actually going to turn the tide federally on the status of marijuana? I mean, so far, there's been some pretty significant resistance at the federal level, despite what happens in some states.
I think it leaves the federal government with not much of a choice on the matter. You're right, there has been a reluctance on the part of the federal government to reclassify marijuana, or to just drop the laws from the books, the prohibition laws from the books. But they have reacted to a lot of these states that have chosen to legalize marijuana recreationally by telling their agents basically to stand down. We have, of course, seen some growers and some establishments busted up, but for the most part, people are allowed to operate in a lot of these states as long as they're operating in accordance with the law, free from a lot of federal government intervention. And I think President Obama's Justice Department is respecting that somewhat, mainly because, is that really the fight that the Justice Department wants to take on right now, given all the other issues about prisons and, we imprison the most people anywhere in the world. I don't think we need to go around busting more potheads, and I don't think President Obama's Justice Department is interested in that. Having said that, I could easily see a different Justice Department, even a Donald Trump Justice Department, who's a guy who's going around touting himself as the law and order candidate, deciding that they don't care what all these states are doing. I mean, the federal government still is well within its power, since marijuana is still against federal law, to crack down on all this stuff. But I think the smarter approach, which the Obama Justice Department has sort of taken, is stand down and let these states do what they want.
Last thing I want to touch on, Sam, there are some who are opposed to both decriminalization and legalization of recreational marijuana, who say once you opened that door, there's no way to justify keeping any drug either criminalized or at least sort of like a civil violation for its recreational use. I tend to resist the slippery slope arguments unless there's a really strong, compelling case to be made for it. Is there one for that argument, or does that not really make sense?
I don't think it makes much sense either. I mean, just the fact that we've we have alcohol and cigarettes legal, and we've managed to resist all the rest of the drugs from being legal. Also, I'm somewhat sympathetic to the argument that perhaps all drugs should be legal. I know a number of countries around the world have experimented with this and have seen positive results, but that's going maybe pushing it a little farther than we need to be pushing it right now. This idea of marijuana being a gateway drug, I find it somewhat laughable, as though it's a unique type of gateway drug. I mean, I went to college. I hung out with the kids who were doing marijuana, and I hung out with the kids who were doing harder drugs, and you can tell there wasn't usually a link between those two types of kids. If you want to see what a gateway drug is, look at alcohol and the effects that has on an individual and how that pushes an individual to do other drugs. And it's just a matter, I guess, of the DEA and the Department of Health and Human Services waking up to this. There was that infamous clip a few years ago when Jared Polis was questioning the DEA administrator, Michelle Leonhard, in which she refused to say whether or not heroin is a more destructive or a more harmful drug than marijuana.
Yeah.
Well, she's now left, and we now have Chuck Rosenberg, who is slightly better. He admitted that heroin is worse than marijuana, but yet he called medicinal marijuana a joke. So only slightly better. There still needs to be a lot of growing up among the leadership over there.
Yeah, incremental improvements, I guess. Sam Sachs, writer, reporter, co-founder of the District Sentinel. Sam, great to talk to you. Thank you.
Yeah, thanks a lot, David.